Hello, everyone. This is Empowering Democracy. I'm your host, Joe Firestone. And our topic for tonight is Dump the Corruption and the Public Option. Why the public option? Why be concerned about the public option? Because a candidate for the presidency, specifically RFK Jr., has mentioned that he prefers the public option to Medicare for all because it seems to him that it's not quite as heavy a lift and is therefore more practical to try to bring about. Well, one can say a lot of things about that. And I will say a lot of things about that here. My device for saying those things is going to be to go backward in time somewhat and to go through 4 articles of my own, actually blog posts, that are quite old now, that were written in 2009 during the height of the fight over healthcare reform in the 2009 to 2010 period, when, of course, Barack Obama was president and the Democrats had huge majorities, both in the Senate and the House. Let me go to the first of these articles now, and that will get us directly into one of the problems with the public option. So let me present the first of these posts now. The title of this post, which, by the way, I had to retrieve from the Wayback Machine, because this blog, the All Life is Problem Solving blog, is not easy to reach at this point any longer, so I had to go to the Wayback Machine. But the title of the blog is Disingenuousness and the Public Option. And I wrote it on July 24th, 2009. At this site, there were no comments on these things. But I was also cross-posting at Firedog Lake, at that time. And there were many more comments at Firedog Lake, but unfortunately, Firedog Lake was destroyed by hackers in, I forget whether it was in 2012 or 2013. It was succeeded by another blog called Shadow Proof, but also Shadow Proof's posts are best reached these days through the Wayback Machine as well. Not all of the posts from Firedog Lake were easily brought over to Shadowproof. So, this blog, which was part of the KMCI, that is Knowledge Management Consortium, the international blog. It was sort of a subset of that. The title of the blog was All Life is Problem Solving, and I've accessed it through the Wayback Machine and the archives on the blog itself. And again, the title of it is Disingenuousness and the Public Option. So let's go through here. Last night it occurred to me that the public option idea is a disingenuous approach to healthcare reform. Here's the argument. Talking to other progressives, I've noticed that they all freely say that single payer will work better than a public option, and that is the best alternative they know. And they also go on to say that they're supporting a public option rather than single payer because it's more politically acceptable and will result in a single payer system anyway after a number of years, since everyone will switch to the public option. Now, that's not too far away from RFK's thinking on this subject, is it? Even though this was written in July of 2009, and here we are in July of 2023, somehow somebody's thoughts haven't changed about the public option in spite of the utter failure to pass it in 2009 and 2010. Going on with the piece here, the question is, would these progressives support a public option if they thought it would not result in a single payer system? And I replied to my own question. I said, I don't think so, even though their counterparts in the U.S. Congress are currently fixing to do just that. As a recent post by Kip Sullivan, thanks to Ralph Bond for the reference, shows. Now, Ralph Bond gave me this reference. In a comment of his on Firedog Lake, which is not available right now. But the post by Kip Sullivan was at pnhp.org. And if you click on the link, it will bring up that particular post. It was a wonderful post by Kip Sullivan. And it was called Bait and Switch, How the Public Option Was Sold. And it contended, and I think it was proved out, that the image of the public option and what it would do as presented early in 2009 was very far removed from what was fated to happen, that people were baited into supporting the public option, and what they got out of the legislative process instead was completely different from the public option. Going on. So basically, I think the progressives are trying to fool opponents of the public option when they say that it keeps the private system intact but gives it some competition, quote, to keep it honest, unquote. It's true that it may do that, but the kind of competition the progressives prefer single payer intended to provide is the kind of competition that will drive the private companies out of business. On the other hand, supporters of a public option who don't prefer a single payer are looking for a public option that will leave intact the capability of the insurance companies to safeguard their profits and raise their prices. So their approach is also disingenuous, since they want to use the term, quote, public option, unquote, to prevent any real change. So, by the way, we immediately have to ask the question of whether this is Robert F. Kennedy's attitude too. Now, I don't believe it is. One reason why I don't is because his campaign manager is Dennis Kucinich, who was the co-introducer of John Conyers' Medicare for All bill in the Congress in 2009. In other words, this was the Conyers-Kucinich bill, the Medicare for All bill was. So, I tend to think that RFKJ has persuaded Dennis Husinich, that he in fact is sincere when he says that he views the public option as a transition to Medicare for all. Anyway, going further, these two types of supporters of public option plans are both taking a disingenuous approach. They're really partisans of either single payer health care or of the profit system in the private insurance industry, donning sheep's clothing. The question is, who's going to fall whom? The way it looks right now, it's a pretty good bet that it's the progressives who are getting fooled and not the partisans of the insurance industry. I think that sentence was pretty prophetic of me on July 24th of 2009, because obviously the whole struggle over the public option during 2009 was this bait and switch operation that was tagged also by Kip Sullivan, and the struggle was carried on in such a way that it was like kabuki theater, and the people within the Congress, especially the people in the House, and a good many people up in the Senate too, had no intention of ever passing a public option. They just wanted to make it look good. Now, how about a third alternative, I say in this post? Isn't it possible that some who say they support a public option are not looking for one that will drive private insurers out of business, or that will be too weak to influence prices and profits? This third alternative, the quote, honest broker, unquote, approach to a public option is conceptually possible. But the question is it practical? Will it work to both bring down costs and allow room for the insurance companies to continue to enjoy high profits? And I say, I doubt it. The reason is that markets are not self-regulating, and no market can ensure that the public option will not dominate the others, or that the private insurers aren't going to be able to dominate, even if a fairly strong public option is instituted to begin with, which I say doesn't look likely right now as of July 24, 2009. At the beginning, everything would be poised on a knife edge to maintain the market equilibrium and prevent its tipping one way or another. Will require very heavy regulation by the government. In my view, this sort of arrangement is just not worth it. It provides a guarantee of continual headaches in making sure that it stays poised on a knife edge and does not tip over to the private or the public side of the equation. Moreover, the arrangement will be very vulnerable to short-term political trends. When Republicans are in office, there will be pressure and perhaps even additional laws to weaken the public option. We have seen Republican administrations simply break the effectiveness of public agencies one after the other, in part by appointing opponents of those agencies to head them and then gut them. On the other hand, when Democrats are in office, the regulatory system will be used to make the public option more competitive, but depending on who the Democrats appoint as the regulators, the degree of competition allowed may be less than intense. For these reasons, the third honest broker orientation to the public option will, I think, be much more unstable and unsustainable than either of the other two disingenuous approaches. So it will fail. And if history is any guide, the health insurance lobby will probably overwhelm it, and it will tend over time to produce the ineffective public option that progressives fear, even if that is not the result of the original bill. For progressives, then, the only good outcome of the present effort at reform, the 2009 effort, is to get legislation with a public option that will evolve into single payer. And this, by the way, is what Bobby Kennedy says he wants, right? But Republicans and blue dogs know this very well. And they seek, those, of course, are the Blue Dog Democrats like Manchin and Sinema, know this very well, and they seek a public option that won't constrain the private insurance companies substantially. So both sides are trying to bring about what they want by internal political maneuvering in Congress. Since the term public option is now vague and ambiguous, there is plenty of opportunity to construct numerous alternatives, all carrying the label public option that Congress can consider. All kinds of shadings and maneuver are possible in this process. Furthermore, it is easy to introduce complex alternatives that require close analysis to understand and that have pitfalls and in practice might prevent the success of a public option. Whatever the result of this maneuvering, in reality, it will carry the term, quote, public option, unquote, and the winners of the legislative struggle will be able to claim that they have fought and voted for President Obama's, quote, a public option. Of course, by July, it wasn't so clear that President Obama wanted a public option, okay, even though at the beginning of his term in office, he sort of indicated that he was in favor of the public option. He wasn't in favor of Medicare for all, but he was in favor of the public option, right? In the end, what have progressives gained and what have they lost by allowing single payer to be taken off the table? Because in 2009, they did that. They were hoodwinked. They were baited, successfully baited by the public option, and they wouldn't fight for Medicare for all. The Conyers-Kucinich bill was introduced, but it was taken off the table. It went to committee, and it died there in 2009, 2010. Well, they're still getting the charges of, quote, socialized medicine, along with heavy advertising directed at the public option. They're also still getting a lot of static about cost, since public option plans are probably more expensive than single payer. Next, they haven't gained any support from Blue Dogs or Republicans because they've offered a public option. The Republicans are all voting no, and the Blue Dogs are trying and probably succeeding in creating a public option that won't work. And that will provide increased payments for providers relative to Medicare. Of course, there appears to be greater openness of interest groups to the public option than there was the single payer. However, the openness is restricted to a public option that won't cut into profits rather than one that will. On the loss side of things, by taking the disingenuous approach, the progressives have fooled no one. But they have sacrificed the advantage of simplicity. I got to mention here, the public option bills that finally came out of the legislative process, but never got to the floor for a vote, were pretty complex bills. They were 1,300 pages long. While H.R. 676 at the time, the Medicare for All bill that they left behind, was a 35-page bill that anybody can understand. So, they have sacrificed the advantage of simplicity, and they have given all sorts of opportunities for amendments to Republicans and Blue Dogs. Instead of an expanded Medicare bill that everyone fully understands to defend, the progressives will have a very weak public option bill to explain and then to defend. If they end up favoring it, they will have to explain to the public why this complex bill will work. If they end up opposing it, they'll have to explain why it's not a real public option, quote unquote, and why it won't work. It's not going into effect until 2013. If it's not going into effect until 2013, then progressives will have to explain to their supporters why it can't be implemented until then. Okay, in the event, by the way, the eventual bill, the Affordable Care Act, didn't go fully into effect until 2014. And then they will have to explain why they are so ineffectual that they've supported a bill that won't be implemented until 2013. They never did adequately explain it. Everybody thought the Democrats extremely ineffectual. The public option bill, which wasn't passed, but the Affordable Care Act, which was passed in 2010, was not something the Democrats could successfully run on, okay, in that year. It was eventually accepted as a minor improvement, but was never particularly popular and is not popular to this day. Can you imagine passing a bill in 2010 that wasn't to go into effect in 2013 and to claim a victory for that bill when the eventual Affordable Care Act, which didn't have a public option, of course, okay, was passed? It wasn't going to be fully implemented until 2014, and the Democrats were celebrating it on the floor of the House with champagne when they passed it. Everybody else in the country wondered why. In addition, progressives have lost the advantage, I say here, of a simple political situation in which they might have had better leverage on the blue dogs. With only a single payer bill actually representing the progressives, the blue dogs would not easily be able to create amendments to water it down, since what single payer means is very clear and everyone understands what it is. And by the way, there was a 35-page bill introduced into Congress on it. The Blue Dogs could not both introduce amendments to destroy single payer and also claim they were supporting single payer as they can with the public option. That's what was going on back in 2009, by the way. Oh, we support single payer, but we can't pass it right now, so we're going to go with the public option, and then we're going to fool around with the public option and water it down, so it couldn't even possibly survive, much less get the single payer. Finally, since the idea of public option is new, progressives can point to experiences where it has worked. It doesn't exist in any of the states and has not been implemented in any other nation. So, by proposing a public option, they've sacrificed the advantage of pointing to the experience of other nations in implementing single payer. Some progressives think that Americans are so blinded by pride in our own way of doing things, or so persuaded of the truth of American exceptionalism, quote unquote, or so steeped in attitudes created by long standing myths about healthcare works in the UK and Canada, that presenting to them the experience of other nations with single or government run insurance systems wouldn't work and would make them hostile to the idea of reform. I then said, I think this view is an assumption that has not been tested appropriately empirically and is just an article of faith among those who consider themselves more sophisticated about politics than other people. I'm well aware of the cliche that no one has ever lost anything by underestimating the intelligence of the American people, but the nomination of Barack Obama himself refutes that cliche. Of course, I was still being diplomatic about Barack Obama. By in July 24th of 2009, I got increasingly undiplomatic as time went on and was critical of him actually fairly early. But I but the nomination of Barack Obama himself refutes that cliche, since it shows that Hillary Clinton often underestimated the intelligence of Democratic voters, which was why Barack Obama was able to even get close to her in the early days of their competition. I still think that most probably Barack Obama was a better choice than Hillary Clinton in 2008. So, to some extent, I still stand by that particular opinion. Anyway, going on. We Americans know that our system has failed us and that it is projected to fail us even worse in the coming years. This was in 2009, by the way. They know we need a new system. They can be told, and they will accept the idea that it may be valuable to look at the experience and results of other nations whose citizens live longer than we do, whose infants survive more frequently than ours, whose citizens never die because of lack of health care coverage, and also never find themselves going into bankruptcy because their bills for medical care have ruined their economic lives and often their family lives as well. We do not have to do everything these countries do if aspects of their systems do not, for one reason or another, appeal to us. but we must at least attend to what they have done to see if we can learn anything from them about how to be as or more successful than they are. And here I have to make the comment with respect to the present context of politics. Here is Bobby Kennedy projecting himself as someone who takes a critical look at things and who learns as he goes along. I mean, Bobby Kennedy is projecting himself as the great learner. Well, why doesn't he spend some time to see if he can learn anything from successful single payer systems abroad? To not look at their experience and consider it, to go on with the post, is nothing more than to stick our heads in the sand and refuse to attend to the reality around us. If we insist on acting like that, we will never solve any of our problems, including the problem of reforming our healthcare system. I just don't think that Americans, long said to be the most pragmatic people in the world, are that closed minded. I might have changed my opinion about that since 2009, because I certainly don't think we've been very pragmatic for the last 14 years. Anyway, that's the first of these pieces. Now, I need to point out before I go on to the second of these pieces, what people were envisioning at that time as a public option was the creation of a public corporation, okay, an insurance company, but publicly owned, that would compete with the private insurance companies. That's what the public option meant in the summer of 2009 when I wrote, okay, this particular post. Now, there was still endless variations on the public option because the public corporation that was to be created could have many different kinds of characteristics, and it was never clear from the public option plans what characteristics they were going to have, except, of course, the bill that came out of the Ways and Means Committee in June of 2009, which got actually costed out by CBO and projected out as well by CBO. And the evaluation of it at that time was that it was going to be a very weak public option bill that was going to cover no more than 10 million of the uninsured people, okay, in this country. But there were lots of other proposals that were floating around that never received any close specification. Now, over a period of time, not so long a time, other conceptions of the public option emerged. For example, in the fall of that year, Alan Grayson put forward a very simple public option plan. Specifically, it was a proposal to let everybody to buy in to the Medicare program or buy into the Medicaid program, okay, or buy into both. But that was another sense of the term, entirely different sense. It did not envision a public corporation that would be immersed, okay, in a market and would be competing with the private companies. It just involved people paying to get into Medicare, okay, or into Medicaid. Okay, so that's a different option and one that was not being debated in July of 2009. So let me now go to the. Oh, Dee is here. I didn't hear her come in. Hello.
Hello.
Hey, I'm sorry, I didn't hear you come in. Have you been here for a while?
Actually at 9:27.
Oh,
I
so
know
only
9:27 because I commented in there. I said hello, everyone.
Oh, okay. I'm sorry. I was just, right in the middle of reading that piece. I'm going through 4 pieces that I wrote during the fight for healthcare reform uh, during 2009, 2010. But the 4 pieces I'm going through were all written in the summer and fall of 2009. I wrote a number of
Okay.
pieces in 2010 as well, but these pieces are about the public option and some of the problems, okay, with the public option. In reading the first piece, what I emphasized was that uh, the vagueness of the public option was such that people could be disingenuous about it. Now, even though they were envisioning a public corporation that would compete with private corporations inside of a market, uh, most of the debate on the subject was not more specific than that, so that there could be many variations on the public option, and you never knew what anyone was talking about when they were, saying they were for the public option. And so this vagueness led was characterized. I shouldn't say it was characterized, but it was accompanied by disingenuousness, where the progressives had one kind of public option in mind, the Blue Dogs and the Republicans had another kind of public option in mind. And basically, to summarize it, what the progressives were trying to get was a public option which would drive all of the private companies out of business. What the
Mm-hmm.
conservatives were trying to get was no public option at all, or a public option that could easily be driven out of business by the private corporations in the market. Okay, and then there were some people who were trying to think of things, okay, as an honest broker, and were trying to craft, okay, a public option that would somehow sustain itself as a public corporation while engaging in all the market activities that would be necessary, but that somehow would be able to sustain itself and not either fall to the public side, okay, or the private side. So that was to be poised on kind of a knife edge. And of course, that was going to be very, very difficult to actually design, okay, and to maintain. And nobody succeeded in actually designing something like that. What came out of the Ways and Means Committee in 2009 was a version of the public option that was going to cover only 10 million people, and that wouldn't have sufficiently great power in the market to lower healthcare costs or to serve as a competitor for the private companies. It was basically designed to fail by people in the Ways and Means Committee, specifically Democrats who were in control of the House at that time. So it was a concession, essentially a public relations concession to the progressives, but it wasn't anything that was really going to do anything.
Hmm.
And it was soon just completely put on the shelf. Okay, there was a lot of further discussion and fight over the public option, and the whole thing finally resulted in the passage of the Affordable Care Act in March of 2010. But what I wanted to bring out in the first article was the difficulty of designing a public option that would be a public corporation that would compete inside of a market and not either be one that would quickly evolve into Medicare for all or be one that would quickly evolve into a failed option, a failed public option. Uh, so that's one of the faults of the politics, okay, of the public option. Now, I was about to go to the second piece I wrote,
Yeah,
which is
Jeffrey
called,
has something here.
huh?
Jeffrey Denton's here. He says, from what I heard, incarnation of the public option winds up being a massive subsidy giveaways to insurance conglomerate cronies and campaign donors which the public is ultimately left on the hook for. Yeah, that's the private one you were talking about, the public option that the Blue Dogs.
That was the kind of public options with the Blue Dogs, which the Blue Dogs were kind of trying to get out in early June of 2000. Well, I guess it was in the middle of June of 2000, okay, and 9. But in the various fights over the public option that ensued, that public option was left behind actually fairly quickly, and people kept on bringing up uh, various ideas, okay, of the public option, and I'll cover that, uh, okay, in these other posts that I'm going to present. So here's the second of the posts. This is called Reflexivity and the Politics of Health Insurance Reform. And this was written not too much later than the first post on August 7th, 2009. And again, I published it here, and okay, this site, okay, is now not now easily accessible, and you have to get to it, by going through the Wayback Machine. But anyway, let me go on with it at this point. The politics of health insurance reform is a great example of reflexivity. Reflexivity is the idea that acceptance and assertion of our beliefs about reality has an effect on how we act, which in turn has an effect on reality and to some extent creates it. And equally, reality influences what we think about it and how we act, thus closing a reflexive circle. George Soros, who of course these days is very unpopular for good cause, had written a lot about the idea, okay, of reflexivity, okay, particularly in what was it called? The Age of Fallibility, okay, I think, which was an attack on the war, okay, on terror, and was very concerned with the reflexivity notion. But I'm not going to go on with that, explaining what that was here because it's off topic. But he focused on the idea of interference and specifically on the interaction of the cognitive and the manipulative functions underlying human decision making, okay, and action. In current health insurance reform politics, it was decided early on that America wasn't ready for a Medicare for all single payer program, and therefore that it was not feasible to try to pass such a program. Now, doesn't that sound like Robert F. Kennedy Jr. right now?
Mm-hmm.
Writing early on, right at the beginning, that America isn't ready for a Medicare for all single payer program, and it's not feasible to try to pass it. As Bobby Kennedy said in the stream that I did a few weeks ago about this, that we did actually a few weeks ago, he thought it was too heavy a lift. He was quoted as saying that, okay, in the stream that Rising did, where he was interrogated, actually by Brianna Joy Gray, who brought out that statement from him that this was going to be a very heavy lift.
The great incrementalism. How many times have we heard that term, incrementalism?
How many times, indeed, have we heard that term, incrementalism? And how many times has that form of process, political process, how many times has it failed us?
Mm-hmm.
This decision seems to have been made collectively by key members of the Obama administration, including the president, as well as key members of Congress, including the heads of important committees, such as Teddy Kennedy, who was the chairman of the Help Committee at that time, who's the chairman of it now, Bernie Sanders, Charlie Rangel, George Miller, and others, the Speaker of the House, who at that time was Nancy Pelosi, and the Majority Leader of the Senate, who at that time was Harry Reid. Outside of the government, okay, progressive interest groups such as Move On, Healthcare for America Now, which, by the way, that was a group that was largely funded by Soros, okay, to the tune of $10 million. There was another major funder who also put another $10 million down for HCAN. Also made that judgment early on and have supported the administration in taking, quote, single payer off the table. In addition, key influential individuals like John Podesta and George Soros have supported that view, with Soros becoming one of the major financial benefactors of HCAN. And you remember John Podesta was Hillary Clinton's cat's paw, okay,
Mm-hmm.
basically representing what Hillary Clinton thought, okay, and what she wanted. Uh, Of course, when high level political leaders and influential interest groups and individuals decide that Medicare for all is infeasible and then act based on the basis of their conjecture to take it off the table in Congress and marginalize people like John Conyers Jr., Anthony Weiner, Dennis Kucinich, and Bernie Sanders who favor it, they don't test their conjecture about its feasibility, they self fulfill it and provide a clear example of reflexivity and the unanticipated consequences often associated with it. And the irony of this example is that George Soros, the longtime student of reflexivity, is heavily involved in an operation where a commitment to a particular construction of reality has given rise to unanticipated consequences that neither he nor his allies have bargained for. Okay, the decision to take single payer off the table in Congress and off the agenda of major interest groups contributing to the healthcare debate has removed the awkwardness of having to entertain and give serious consideration to two progressive alternatives in Congress. But it has also deprived many of the progressive movement of the chance to support and work for their preferred healthcare solution, and it has done so in a way that Medicare for all supporters think is unfair and frankly not very bright if one's objective is really to pass laws with either Medicare for all or at least a strong public option. Remember, there were different variations on the public option. So the question arose, would it have been better to do everything to try to pass a Medicare for all bill, and then if you had to go into bargaining and come out with a strong public option, then basically what happened, which was to take Medicare for all off the table, not to campaign on it, put up a weak public option, then being unable to pass that, ending up with the abomination of the Affordable Care Act, under which, by the way, the fatalities each year kept on growing and multiplying. The impact on some single payer progressives of taking their favorite alternative off the table without a fair hearing is to leave a residue of resentment and anger among these progressives, and also a feeling that the administration can't be counted on to support progressive forms of legislation when it has the chance to do so. Those folks are disinclined to stay active in the healthcare debate and therefore to respond to current appeals by the administration and its supporters to join with them to fight for health insurance reform. In other words, by taking Medicare for all off the table, the administration undercut the mass support that it might have had for the public option, which it ostensibly wanted, but which probably it never did want. The impact on still other single payer progressives is confusion in their writings about insurance reform. A good example of that is in Guy Saperstein's post at Alternet, entitled, quote, "The only option for health reform is the public option," unquote. Saperstein does a really good job in his post of rehearsing the reasons why health insurance reform is necessary, including a variety of well known statistics showing how poorly performing our system is compared to systems in the rest of the world. He also covers cost issues well, points out that the U.S. spends twice as much per person as our nearest competitive, Canada, and the private insurance system spends $300 billion per year in administrative costs and another $300 billion in marketing costs and profits. But when it
Mm-hmm.
comes to talking about solutions, Saperstein adheres closely to public option supporter talking points, specifically the most logical correction to the costly inefficiencies of the American private health insurance system would be a single payer system, such as Medicare, a popular and successful single payer system. An acknowledgement here that the best solution is single payer, a Medicare for all system. But then he continues, that is, Saperstein does, quote, but single payer has proved to be too radical a change for Congress even to consider this time around. So we are left with the possibility of a quote public option unquote, which would allow individuals and employer plans to buy into a public system modeled on Medicare. And I say, quote, too radical for Congress, is it? Too radical, unquote, for Congress, is it? Where are the quotes and references to back this statement? The House has 85 co sponsors of H.R. 676, John Conyers' single payer bill. Also, where's the president in all of this? Didn't Max Baucus claim that it was the president who took single payer off the table? Saperstein then continues. Quote, while this public option may not be the perfect solution, oh, here they come. This is beautiful. The perfect should not be the enemy of the good. Boy, I hated that when they kept saying that because who knew what was the perfect and who knew what was the good? Moreover, if the public option is robust over time, it would outcompete the costly, inefficient private health insurance system. And you would find not only individuals choosing the public option, but also employer health plans concerned about costs, unquote. Quote, the perfect should not be the enemy of the good is one of those slogans that substitutes for argument and reason. First, because we very rarely have the perfect, quote unquote, even as a possibility in politics. And in the case of health insurance systems, the Medicare for all is certainly far from perfect. And we can guarantee that even if we implemented that solution, it would have problems and we would have to be very active in creating and maintaining the affordability of good health care. What we do know from our own Medicare experience and from the experiences of other single payer systems is that such a system works a lot better than our current one. But perfection is not something we are choosing when we decide on single payer. Second, not only is Medicare not perfect, but a public option plan is not necessarily, quote, the good, unquote, either. Right now, the details of any public option that might go through Congress are vague. Some public options may be good in that they might have an effect on costs in the insurance market, but others may be useless in shaping that market and may even have difficulty in assembling a network of providers sufficient to provide good health care to the relatively small number of enrollees the system would have in the first few years. Of course, as Saperstein says, by the way, am I sharing this?
Yes, you are.
Oh, good. Thank you. I just didn't understand. Uh, of course, as Saperstein says, over time, a public option might bring down the cost of private insurance. However, this is not enough to make the plan good because the kinds of public options being considered in H.R. 3200, that was, by the way, the bill that came out of the House in June of 2009, and the Senate Help Committee bill, have no prospect of reducing insurance costs in the short run, which means that public option plans under consideration are not the good at all, but rather alternatives that will not rid the system of those $300 billion per year of administrative costs, nor would they help at all with the other $300 billion in marketing costs and in lower profits. Nor would these bills lower costs below the $6,001 per person we spend now. I guess I have to add, last I looked, we are now up to something like, I think it's $12,000 per person that we spend now. So, this whole period of time when the Affordable Care Act was passed and all of the angst that was attached to it and the efforts to implement it and the innovations by CMS in relation to the Affordable Care Act have had the effect of doubling the cost per person. They would be very likely to increase those costs by a substantial percentage each year without a constraint on cost inflation imposed by the legislation, okay, the final legislation. I have to emphasize here the Affordable Care Act doesn't have any constraint on cost inflation, and the public option bill that originally came out of the House had no constraints on cost inflation. In short, insofar as a single payer solution can claim the advantage of eliminating hundreds of billions of dollars in private insurance companies' administrative, marketing, and profit costs, lowering pharmaceutical costs through bargaining with the drug companies, and removing the burden of health insurance from all of our businesses, these overwhelming advantages cannot be provided by a public option of the sort we find in H.R. 3200. At best, such a public option might begin a decade-long process that would finally have its intended effect. But in the meantime, the United States would still have the most bloated health insurance system in the world, and unless other aspects of the administration's healthcare reform are effective, one of the worst performing healthcare systems among the wealthy nations of the world. I wrote this August 7th of 2009. It's been 14 years since then. We still have the most bloated health insurance system in the world. And we also have one of the worst performing healthcare systems among the wealthy nations in the world. So, what Saperstein gives us is an argument for a single payer system because of its anticipated effects in lowering costs, but then confused thinking sets in when the case for single payer is taken as justifying a public option as, quote, the good, unquote, based on what it would accomplish if it ever did morph into a single payer system over a long period of time. The only problem with this argument is that the public option is not, quote, the good, unquote, in any practical political time horizon that will mean anything to ordinary people. A supposed solution that will solve the problem in 10 years is no solution for today that anyone ought to be interested in, since during that 10 years, the chances are overwhelming that someone will come up with a solution that works within a year or less, especially if they become sufficiently fed up with the dysfunctional system we're living under to get out from under their ideological prejudices. In addition to sowing anger, resentment, and confusion among progressives, the judgment that Medicare for All wasn't feasible also had the effect of shifting the spectrum of healthcare plans being considered over to the right. This has to have hurt the negotiating position of the public option. As many have remarked, the public option no longer seems like a compromised position, and therefore it can easily be painted as an extreme left wing solution, which, by the way, is exactly what happened in the summer of 2009. But if Medicare for All was on the menu, public option plans would be seen as compromises, and depending on how strong single payer was, it may have had a much stronger position in the negotiations than it has now, I said, as of August 2009. So finally, it seems that the strategy of the president and the interest groups and individuals to back a public option and tell everyone that Medicare for All is off the table has had the unintended effect of weakening the public option itself. I'm being charitable by saying it was an unintended effect. It might have been a very deliberately intended effect. So that's what we now face are alternatives that are unlikely to be successful in solving the problem. The result was produced by reflexivity by the vagueness and ambiguity of the public option idea and by the failure to think through how others would react to taking single payer off the table. It has finally left the administration with a big problem, the problem of mobilizing support for a healthcare reform that no one understands or loves. That's what happened in the summer and fall of 2009. That's what happened because Obama didn't pass a single payer plan in February of 2009, which he could, by the way, have done if they had gotten rid of the filibuster. The problem of mobilizing support for a healthcare reform that no one understands or loves. And when the administration appeals to progressives to get excited about such a plan and to go out and fight for it, the progressives have no idea what they will be fighting for. So this is a major danger for RFK Jr. right now. He says he's for the public option. Who gets excited about that? Why is that any sort of advantage for his campaign?
It is not an advantage. People are sick of this. People want Medicare for all. They want single payer. They do not want. I mean, this is past news. This is old.
This is old. They do not want a public option, okay, at all. They will be suspicious of someone putting forward a public option and of someone vaguely nodding to a public option, which is what RFK Jr. is doing now. When people ask him questions about healthcare reform, they're going to be trying to get to what he means by healthcare reform and, of course, what he means by public option. And everybody, lots of people, even with all the other problems we have now, 88% of Democratic voters are for Medicare for all. If you're challenging an incumbent president, you cannot be successful in challenging that president when you don't fulfill the wishes of 88% of the Democrats who are likely to be voting in the primary. I mean, that's just stupid. Forgive me. Okay. Here's the next piece. It's called Strategy, Tactics, and Movement in Healthcare Reform. Oops. Sorry, I had a couple of pills to take. This next one was written on November 19th, 2009. I should share it. These again are from the Wayback Machine. They are no longer easily accessible on the web, though they now turn out to be very relevant, so maybe I'll make them accessible again. So, it is important to sharply distinguish strategy from tactics in healthcare reform. I think strategy is about your goal and overall orientation toward getting healthcare reform, while tactics are about the low level things you do to get from point to point and getting the strategy implemented. Tactics are influenced by strategy in the sense that tactics need always to be evaluated from the standpoint of whether they advance strategy or not. If they don't, they're counterproductive and need to be put aside in favor of other tactics. In my view, much of the healthcare reform movement made a great strategic error in this fight. And that error was to make the strategic goal a public option solution, which is what Bobby Kennedy's done, right? Rather than to make it a Medicare for all solution, or at least what he's in the process of doing. That error has shaped everything else that much of the healthcare reform movement has done for the last year. Again, this was in November. And is the one thing primarily responsible for the sorry outcome we have on our hands now in both houses of Congress. So by November, it was obvious that the public option had failed and was not going to get into any bills for healthcare reform. I think we have to learn from the experience of the past 10 months and stop boosting the public option, even a very strong public option, as if it were a strategic goal. I think Medicare for all should be our standard, and we should evaluate our success or failure in political activity by how far we've moved the ball toward this goal, not by how far we've moved the ball towards getting a PO. The PO, even a Jacob Hacker type of public option, is at best a tactic relative to the overall strategic goal of getting to Medicare for all. And we should never forget that or let other people forget that. Since it is a tactic, we should be treating it as a tactic, something we resort to in order to overcome blocking or resistance, not something we pre-compromise on before even testing the strength of resistance to our efforts to get something better. I think also that treating the PO as if it were our strategic goal was a very bad tactic. It did not elicit the limited opposition and pragmatic but useful compromise for our side that many progressives anticipated and talked about as a benefit of going the public option route. And its messaging has been and still is horribly confusing and disingenuous. It has elicited all kinds of fears from the public that Medicare for all would never have elicited. Since tactics are not independent of strategy but are always shaped in the context of it, adopting the public option as a strategic goal has shaped our tactics by constraining us from doing some things. We can never call on a mass movement to support us in getting healthcare reform because who can really get excited over a public option that won't produce universal coverage? We could never develop simple messaging that was honest because all the simple verities about stopping the fatalities, providing universal coverage, making things really affordable, and really saving money for the country don't really apply to the PO plans we've been seeing in House and Senate bills. Even now, nearing the end of the legislative process, we are seeing simple messaging about the great, quote, victory, unquote, a bill with a shrunken PO that is not honest, since it greatly exaggerates the expected positive effects of the legislation while ignoring its many downsides. The kinds of claims we are seeing now from Democrats in Congress would be honest justifications for Medicare for all if Congress were passing H.R. 676, but they are dishonest ones for the PO plans we're seeing in H.R. 3962 and Harry Reid's new Senate compromise. And who can get excited and fight hard while using messages that you know are not true? Maybe
Mhm.
conservative or paracheeks can do that. But liberals and progressives find that very hard. They need to believe in what they are doing and what they are saying. I agree with Jane Hampshire. Jane Hampshire was the owner of the Fire Dog Lake blog, which was very important at that time. That Medicare for all supporters ought to ask what they could have done differently to have produced more success for their favorite alternative. But I think an important related question is what can Medicare for all reform and advocates do differently now? What can give a different result that is closer to the strategic goal we're pursuing? And I think that's the answer to that at the level of high level tactics is that we have to build a mass movement to the background of what we do, but day to day, because without that, we aren't going to get Medicare for all through the Congress. Some groups out there are trying to build that movement, and it may be gaining steam. And by the way, some groups are still out there trying to build that movement. The Red Beret group is still out there trying to build that movement. And we have a new film called Healing Us, which is a documentary that people can organize around to build that movement. And it may be gaining steam. this terrible healthcare reform bill will fuel the movement. This will fuel the movement for Medicare for all, whether or not it passes. But realistically, I don't think that movement will be a factor for a few years at the earliest. So what do we do now, day to day? So I had said that, assuming that they would pass the terrible healthcare reform bill that they were getting ready to pass. But the fact is, it didn't fuel the movement for even more than a few years at the earliest. I mean, the Medicare for All movement was basically dead until Bernie Sanders woke it up again in 2015. I wrote this in 2009. Passing the Affordable Care Act as it was killed the Medicare for All movement in the United States until 2015. That's how costly passing that bill was. It would have been better if that bill had been defeated, as by the way, I said at that time. I wrote some other blogs that I'm not going to talk about here today, but one was entitled Kill the Bill, and another was entitled 9 Reasons for Killing the Bill, because I knew that bill was going to drain all energy out of Medicare for All as of November of 2009. So what do we do now day to day? I think we ought to pressure progressive politicians in the House and the Senate to be movement politicians, to become movement politicians. Movement politics is different from conventional politics. And movement politicians often have to use different tactics because they're trying to get principles adopted. And so they have to defend those principles and not easily compromise them, except perhaps at the end of a lengthy legislative process when there is no other alternative and they can get something very, very valuable for the compromise. Well, like, okay, for example, let's say we're fighting for Medicare for all now. Okay, and we get to a compromise. In other words, the other side is willing to compromise with us by putting half of the nation, okay, on Medicare for all. Okay, and doing a public option uh, for the other half of the nation. That would be a compromise that would be worth getting because it was getting so close to Medicare for all, and it was going to be able to demonstrate the effectiveness of Medicare for all because it had half the population. It would also destabilize the insurance companies and give them all sorts of problems too. So that would be the kind of compromise that would be worthwhile getting. It's important to get people to understand that movement politics is not about not compromising. Instead, it's about not pre-compromising or abandoning one's strategic goal or making compromises that mortgage the future of movement possibilities. One of the worst things about the current House bill is that it risks wholesale rejection by the public of the very idea that support, okay, of but progressives and Democrats can really help them against the insurance companies and in getting affordable health care. That's why this bill must be killed. It has been oversold, and the backlash from it is very dangerous to the whole healthcare reform movement. And so it was. So it was. Okay, in the event, as I said, it killed the movement for years to come. We need to persuade, cajole, urge, threaten, and organize their constituents to get our congresspeople to become politicians who are movement politicians. We have to call on them to believe again and rip the hell out of them when they act as if they don't. Like, for example, AOC acts all the time right now. When they produce a piece of crap legislation, we need to not be balanced and moderate in cataloging the pros and cons of the legislation in two matching lists. We have to evaluate their legislation from the point of view of the principles and strategic goals of our movement And we need to call a spade if their legislation gives up core principles, gets us no closer to our strategic goals, and even falls short from a moral point of view. Progressive politicians in Congress are not acting like they're movement politicians who are coming from principle. They're acting like politicians trying to get something, anything done at any cost, as long as it carries the healthcare reform label. This may seem practical because, quote, the perfect is the enemy of the good, unquote. And they don't want to go against their leadership and their president. But in the long run, it's a tactic that won't get them and us to Medicare for all because A, it makes them look like corrupt politicians, and B, no one will take Medicare for all seriously unless its advocates are willing to make everyone pay a price for trying to marginalize their strategic goal and laugh at it in the legislative process, which is what, of course, the Democrats were doing in 2009. In my view, the first thing for Medicare for All advocates in Congress to do is to defeat any other health care reform that either one doesn't provide a clear possibility of getting to Medicare for all in a reasonable time, or two, threatens the political prospects for getting further reforms that will provide that clear possibility. There are currently 87 co sponsors of H.R. 676 in the House. That many representatives would have blocked any healthcare reform that wasn't Medicare for all the first time around if they were playing movement politics. Unfortunately, they were playing it merely symbolic stuff, kabuki, in their co sponsorship, not making a real commitment to H.R. 676. Had those progressives put themselves on the line and made the leadership and the administration taste defeat for trying to marginalize H.R. 676, people wouldn't laugh at Medicare for all or progressives anymore. Uh, by the way, in those days, the administration, Rahm Emanuel in particular, was mocking and laughing at the progressives constantly. Old Snakehead was doing the same. Paul Begala was doing the same. Wouldn't laugh at Medicare for all or progressives anymore. Instead, leadership in the administration would start to bargain, and the progressives would have had an opportunity to drive a hard one. That bargain could have ensured one, or two above, even if the resulting bill was no more than something like ending all insurance company abuses and stopping there, leaving the future unconstrained for a much more effective healthcare reform bill than we are contemplating now. In writing all of this, I'm painfully aware of not answering the question, quote, yes, but what do we do right now, unquote. I think the answer to this is implied in what I've already said. It is to do everything we can to kill the bills now emerging from the House and the Senate. First in the Senate, and if that fails, then turning again to the House to once again try to get enough of the progressives to stand up to the leadership and vote against it when it comes out of conference. For healthcare reform, that won't take a mortgage out on the future. We need to kill these bills. And in the process, we need to get the Democrats and the progressives to stop being less than honest about what they do and what they don't do. Then, when the leadership and the administration goes back to the drawing board, which they certainly would very soon, we would need to go back to H.R. 676, not compromise until the end of the process when the leadership and the administration need progressive votes to put it over, and then adhere to principles 1 and 2 above in negotiating any compromise. If we do these things, I think we'll get a much better bill than we have now. It won't be perfect since, quote, the perfect is the enemy of the good, unquote. And nothing in this whole healthcare reform debate has been perfect. But even though it will fall short of protection, it will be much closer to being good than what we have now. And the truth is that what we have now is just, quote, not perfect, unquote. It is not good at all. It leaves too many to enjoy that well-known Republican solution to healthcare. Quote, don't get sick, but if you do, then die quickly. For those who don't know, that was a quote from Alan Grayson in the fall of 2009. Uh, so, still, our progressives in Congress, the people who claim to be progressives, in introducing the Medicare for All bill, they're not acting like they are movement politicians for Medicare for All. Yeah, they go through the motions, they introduce bills. The Medicare for All bills are actually good bills, but they don't insist on those bills. They don't defeat other bills unless they get the Medicare for All bill passed. There are something like 125 co-sponsors for those bills right now, way up from the 85 we had then. But they're still not getting any action on health care. They can get a floor vote on health care if they paralyze the House. Or at least they could have when they had control of the House. But they can get a floor vote on health care in the Senate if they paralyze the Senate right now, because they have a majority of the Senate. They have to believe strongly enough in the movement goal to insist on it. And what insisting on it means is paralyzing the workings of the government until you get it. Okay, anyway, so that's for that one. Here's the final one for tonight. This one was just a little bit later. It's called What Might Have Been, What Still Might Be. It was written 3 days later on November 22nd, 2009. It makes use of a particular framework that I often used in the knowledge management field. The framework is very easy to understand. Uh, there are transactions, okay, that are produced by social networks of people. You and me, the mass of people who are transacting with each other, okay, at all times. Those transactions, in some way or other, are received by individual decision makers, people, ourselves. When we make decisions and decide to do things like support a bill or frame a new bill or do a protest or whatever it is we do, we are influenced by social ecology, which includes four categories: the social conditions we act in the context of, the cultural conditions we act in the context of, the geographical conditions, and the economic conditions, okay, as well. The outgoing transactions, by the way, also affect us. They affect the social ecology, but they affect us also directly. And then we make decisions in the context of those inputs to what we're doing. We're not looking at a deterministic process here, because in making the decisions, we create something ourselves that affects the rest of the process. If you remember the reflexivity idea, this is consistent, okay, with the reflexivity idea. So I'm not going to go into the minute aspects of this. I just want to point out that these are the inputs to a complex adaptive system. All the individuals in the political system are complex adaptive systems. The political system itself is a complex adaptive system. These social networks up here, okay, are complex adaptive systems. So whenever I think about political struggles, I think about this framework and how it relates to the political struggles. Anyway, to do the blog now. Many progressives, even though they've been working for a public option-based healthcare reform bill, have never given up Medicare for all as the goal of their activity, and two, decided in the first quarter of 2009 that Medicare for All could not pass, gave the new Congress. They then reacted to their realization by concluding that since Medicare for All couldn't pass, they would not advocate for it anymore politically, but would transfer their activist commitment to getting a strong public option. Last spring, they had in mind a Jacob Hacker type public option, which they saw as the road to Medicare for All. So, in short, they took Medicare for All off the table as something to push for, and they did so because they thought the impossibility of its passing was, quote, reality, unquote. In my other life, in the field of knowledge management, I sometimes work on the idea of reflexivity, a favorite notion of George Soros's, and also on complex systems, a field having to do with the rise of also maintenance and fall of various types of systems, including human organizations of various kinds. Both of these notions are closely related to the idea that to some degree at least we make our own realities, or as some in systems theory put it, we constantly, quote, bring forth our world, unquote. One of the things we mean by this is that to some degree, and especially in social contexts, we and others help to make our own reality. Social reality is not given to us so much as we contribute to making it ourselves. In turn, this means that our futures are not predetermined for us, and that in particular there is no preset future social reality, but rather there is only the reality that we, in concert with our fellow humans, make. Now, getting back to the thinking pattern of a lot of progressives in the winter and spring quarters of 2009, we can see that they decided that a social reality in which Medicare for All was feasible by the summer or fall of 2009 would never occur. And as a result of that prediction, they decided not to advocate for it anymore in this round of reform, but to advocate in just as determined a way for the public option based legislation because they thought that it was the best thing that progressives could possibly hope for in the short run, and many of them thought it might lead to single payer over 5 to 10 years anyway. They set about creating, in other words, a social reality of reform with a robust public option. They may well have been right about the prediction of the fate of Medicare for All, but I think they made a mistake when they concluded further just because Medicare for All was unlikely to happen in the short run, they ought to give up pursuing it and instead concentrate their political activity on pushing for a robust public option. I think this because in deciding to take Medicare for All off the table and working for a public option instead, they have brought forth a world in which the robust public option that was their pre-compromise position proved hard to communicate, became the left wing of the political spectrum of recognized possibilities and the focus of attacks from the insurance industry, and so gave way in the legislative lobbying process to what is likely to be at best a reform with a very, very weak public option or even a trigger that they must really bite their tongues to continue to support. By the way, that's exactly what happened, of course. By committing to tactics of explicit advocacy of a robust public option aimed at bringing about that kind of legislation, they set themselves on a path where the judgment that they needed as rushed to PO as possible always implied continued explicit advocacy of a robust PO at every stage of the legislative and lobbying process, regardless of the degree of defeat suffered at the preceding stage. When the most liberal House and Senate committees came out with disappointing bills that were quite far from the original idea of a robust PO and that had a completely unacceptable band aid period, that was the period until the bill actually was practiced, that is, passed something in 2009, implemented in 2013, during which the majority of the deaths, bankruptcies, and foreclosures due to lack of health insurance would continue, they believed they had to react with support of the best of those bills because they offered the best available public option on the continuum of robustness. When the committees merged their bills, and even though the result fell far short of their original pre-compromise, that original pre-compromise was on Jacob Hacker's idea of public option, by the way, there was nothing to do, they thought, but support and redouble efforts to prevent further erosion in the public option. When similar things happened in the Senate, the progressives had similar reactions when it came to lobbying activity. In each case where there was disappointment, they revised downward their notions of what was possible and prepared to bring forth a world with a weaker PO based reform. Each time they did that, they took action that was part of a more global process that led to an even weaker public option. This process is a classic example of reflexivity. One's judgment of what is possible leads to one choice of action, which impacts a later judgment of what's possible, which impacts one's choice, or a similar action as before. And so one goes round and round in a deflationary cycle that ends with action defending a PO based reform that is only a shadow of what one started out to support. But going back to the first step, why did progressives conclude that since Medicare wasn't possible in the short run, but the public option was, that in this round of reform, at least they ought to advocate for the public option explicitly and directly and push as hard as they can to get as robust a PO as possible? This certainly seems like the commonsensical and straightforwardly rational thing to do, but it clearly wasn't, because it drew them into a reflexive downward spiral of decreasing public option robustness within every stage of the legislative process until now they are facing a public option predicted to enroll only 3 million people, or perhaps even triggers, which won't be operative until 2014, which may allow states to opt out before the exchange and the public option are operative, and which may even contain the Stupak anti-choice language, which was a feature of some of these bills. The opponents of abortion had this amendment, and the amendment was introduced by this guy Stupak, who wanted the anti-choice language in the healthcare reform bill. He's no longer in Congress, by the way. What progressives could have and should have done instead, regardless of what they believed about the ultimate feasibility of getting it passed, was to have taken the seemingly completely irrational course of refusing to take Medicare for all off the table, mobilized the 87 sponsors of H.R. 676, and insisted they would defeat any reform bill that was not H.R. 676. Had all progressive movement groups held to that particular position, and all progressive legislatures too, loudly announced they would oppose and vote against all committee bills that weren't H.R. 676, loudly announced as well that Nancy Pelosi's synthesis bill had better be H.R. 676 if she wanted their votes, they would have brought forth a completely different world, an entirely different reality this fall. Remember, I'm talking November 22nd, 2009. So imagine if at the first stage of this process, the progressives had not agreed to take H.R. 676 off the table in the House and Senate Bill 703 in the Senate. That was Bernie's bill, by the way. The first thing that would have happened is that the MSM and cable news would have talked about Obama's rebellious party of ideologues who are contradicting all the tenets of pragmatism, who are allowing the perfect to be the enemy of the good, who are insisting on single payer, and who were refusing to accept his leadership and undermining his newly elected authority. Since this opposition in the ranks would have been big news back in January and February, progressives would have gotten interviews and coverage by the press. The press was not as docile to the administration in 2009 as it is 14 years later now. Single payer, enhanced Medicare for all would have been presented to the broader public back then. It and not the PO would have been touted as one of the main reform policy positions, even while it was also characterized as the ideologue idea or position. The support for Medicare for All in Congress, however, whether ideological or not, would have connected to a popular movement for Medicare for All very early on, okay, and enabled that movement. To avoid a fight with the progressives and lots of press articles about how ineffective he was being as a leader, President Obama might have concluded that the best way to go was to feed this popular movement, to find its leaders, to get them into the White House, and to help them to mobilize the public in favor of Medicare for All. Why would he do that? Because every good politician knows that when the crowd starts to move, you need to get out in front of it if you expect to have any control over it at all. The crowd needs to trust you as one of its leaders. And after all, any healthcare reform bill is a great victory for his administration, even if it destroys the insurance companies as a viable political force that can provide campaign contributions either to Democrats or anyone else. The insurance companies would fired on Medicare for All very early, of course, and the pharmaceutical industry too. Both would have attacked it as socialized medicine, quote unquote. But everyone knows about Medicare because their grandparents and parents have it. 86% of them like it. People know it's not socialized medicine, but only government funded insurance. It can be easily communicated to them that if Medicare for All is enacted, they won't lose their providers, but only their insurance companies, which a heavy majority of them hate and mistrust. Anyway, so what about the polls? Well, once the MSM had made the very early progressive insistence on Medicare for All a popular narrative, they would have included Medicare for All in their polling. In fact, there's a good chance their framing would have suppressed polling of the public option entirely because the progressives would not have had it on the table as something they were pushing. Even if that had not happened, however, both Medicare for All and a Medicare-like PO would most probably have polled 75% together, with Medicare for All itself at around 55 to 60%. Actually, now the support for Medicare for All is more like 70% across the board, with a majority of Republicans supporting it and roughly 65 to 67% of independents supporting it, and 88% of Democrats supporting it. The Blue Dogs and conservative Dems would have had a hard time proposing anything in opposition to Medicare for All other than a Jacob Packard type PO. How many votes would they have had? Well, that would have depended on the president. If early progressive stubbornness and the appearance of a popular movement had persuaded them to be friendly to Medicare for All and get out in front of the movement, then the whole group of congresspeople who routinely support a president of their own party, otherwise known as the Congressional Party in Congress, there is a party like that, would have come over to Medicare for All. Adding that group to the 87 progressive co-sponsors of H.R. 676, one would probably have been looking at 200 votes in the House. Not enough to pass Medicare for All, but getting close. And a situation like that was especially true in 2009, where Democrats had something like 245 seats in the House. So my saying that they would have had 200 votes in the House isn't far-fetched in that particular situation, if we had had the support of the president. In a situation like this, and assuming the same, quote, no, unquote, behavior we see now from the Republicans, the result with some leadership and heavy presidential pressure would be that either Medicare for All would have passed the House in a close vote, or a compromise with the Blue Dogs on a strong hacker type of public option would have emerged behind closed doors as a compromise. In this particular scenario, progressives would have had to compromise only once at the end of the process, and there would have been no need to sell the public option idea to the public except as the best alternative possible to Medicare for All itself. What if the president won back Medicare for All but maintained neutrality from the House proceedings while saying in typical Obama fashion that in principle he agreed with it, but, which by the way is what might happen with R.F. Kennedy right now, right? That would still leave, I'm assuming, of course, that he wins the presidency, which I believe that if he doesn't support Medicare for all, he might have a very tough time doing. That would still leave the presidential party in the House as the arbiter between the blue dogs and the more numerous co sponsors of H.R. 676. Uh, if the partisans of H.R. 676 stood very firm, the most likely outcome would again be a very strong PO, much superior to what we have now. How about the Senate? Well, to reasonably project what might have happened there, I think we first have to forget about the political landscape we see now, because an alternative landscape in which the House progressives insisted on H.R. 676 until the very end of the process would have been very different from what we see today. One difference would have been, okay, that the progressives in the Senate would have seen many representatives in the House standing up for Medicare for all, and also an external movement, good polling for Medicare for all, and much better press coverage for it than we see now. Cable news commentators like Chris Matthews, Ed Schultz, Keith Olbermann, Rachel Maddow, and Dylan Radigan would have been covering it far more than they are now, as would various commentators on CNN and Fox, though in a much less complimentary way. Finally, Netroots commentary would have been much more frequent and much more complimentary than it has been. If the president aligned with the House progressives and the movement, and Senate progressives and presidential followers in the Senate would have been much emboldened to follow the House progressives, and more probably more than 40 senators would have fallen in line back of Medicare for all. Not enough to pass the bill, even through the reconciliation or through using a nuclear option. Nevertheless, those votes would have been enough to guarantee a much better compromise bill emerging from the Senate negotiations, especially if Harry Reid made it clear that health care reform would not be subject to the regular order in the Senate, that extraordinary measures would be used to pass the reform bill. With only 10 senators, none of whom were the most extreme blue dogs and conservatives left to bring over, I think the likelihood would have been very good if the progressives held very firm that a compromise on a Jacob Hacker type PO would have been actually negotiated in the Senate too, and one without a band aid period before uh, um, uh, implementation. I've forgotten what the Senate um, situation was in 2009. For a brief time, the Democrats actually had 60 senators, okay, which is enough for closure, okay, but I think they lost that with the death, okay, of Teddy Kennedy, which was, okay, okay, I believe it was in August or early September of that year. And I don't know if there was a replacement, okay, in place yet. I'm going to assume, for the sake of this argument, that they had only 58 or 59 senators, so uh, they couldn't have gotten closer. Okay, filibuster. They would have had to have tried to get rid of the filibuster. If the progressives held very firm that a compromise on Jacob Hacker type PO would have been uh, um, uh, but come to in the Senate too, and one without a band-aid period before implementation. Again, this band-aid period is very important. In the final bill, the band-aid period was from 2010 to 2014. In the bills they were considering back then, it was from 2009 to 2013. In other words, they were passing a bill, they were going to start taxing people for a bill that was not operative. One of the stupidest political things any party has ever done in the history of the Union. It was really, really stupid. And the Democrats put forward and passed that kind of abuse. Imagine taxing people for benefits they weren't going to get for 4 years. What a travesty. What if Obama stayed above the fray beyond endorsing Medicare for all in principle to accommodate the movement? In that case, there would still be roughly 20 votes for Medicare for all, with the House progressives standing firm for H.R. 676 and a Medicare for all movement ongoing. These senators would have done the same, and no health care bill could pass without accommodating them. On the other hand, their hand would be weaker than in the first scenario, because the senators who primarily support the president would be less supportive, more neutral to Medicare for all, and more interested in brokering a compromise deal with the remaining senators need to get for 50 votes so that a reconciliation or the nuclear option could be used to pass a health care reform bill. Nevertheless, stubbornness on the part of Medicare for all supporters would still have worked to get other Democrats to move toward at least a strong PO based bill without a band aid period, because the alternative is no bill at all, and blue dogs in the White House cannot abide that. That was the case in 2009. So much of the country wanted health care reform. The White House could not have given up on it. Uh, but the progressives didn't exert their leverage by putting the White House with its back to the wall. The result would have been a much stronger PO based bill coming out of the Senate, with a Jacob Hacker type PO bill coming out of the House, and a weaker but still very strong PO coming out of the Senate. The conference committee would have produced a bill very close to Jacob Hacker's original design. That's still not Medicare for all. Progressives whose goal is such legislation would still have had work to do in the future, but the result would have been far better than we are looking at now, both for those who prefer Medicare for all and for the relatively few who prefer the PO in principle. Finally, why have I constructed this narrative of what might have been if only the progressives had concluded that the likely eventual defeat of Medicare for all did not entail that they should stop advocating for it and pressure only for a public option based reform? First, because I wanted to make it clear that whether or not Medicare for all is possible to pass in a given legislative session doesn't determine whether we ought to do all we can to advocate for it or seek it. What does determine that we should is an accurate assessment of what the consequences of continued advocacy and pressuring for it are likely to be. Nor is the seeking in such a situation merely just symbolic. It can have a variety of practical effects, including A, educating people about what Medicare for all might mean, B, influencing the context of the legislative process producing healthcare reform, and C, influence in shaping the actual negotiations affecting that process. First, I wanted to sketch out the reflexivity trap uh, progressives had gotten themselves into when they adopted the PO based strategy for getting healthcare reform. Since a public option based reform is a vague and ambiguous concept that represents a moving target for reform, many different positions on the continuum of robustness of PO based plans exist. And this reality of many choices that might fit the idea that PO fits perfectly with the many stages of a bill goes through in our legislative system to produce a degenerative cycle, spiral, of gradual weakening of the PO as the process moves through its successive stages. The PO concept was tailor made for gradual watering down in the crucible of legislative conflict, and commitment to it in the abstract by progressives condemned them to a reflexive process that resulted in this gradual weakening of the PO until the possibilities we see today were created by the progressives' own advocacy guided interaction with other parties in the process. Third, I wanted to make it clear that progressives contributed vitally to the outcome we have now being November the 22nd of 2009, by their choice to enter the reflexive process of getting the PO through the legislative process, while accepting as their goal trying to get the best PO place plan they could at each stage of the process. As soon as they committed themselves in this way, they committed themselves to defeat and failure. They could have created a different social reality by just insisting on Medicare for all and refusing to enter negotiations on the type of PO that would be accepted as a compromise until the very last stages of the process. But they didn't try this because they were afraid of working against their new president or of being entirely marginalized as ideologues or of engaging in protracted conflict with their fellow Democrats. And fourth of last, of course, I want to try to prevent a lesson of the process we are currently still engaged in from being misconstrued. The lesson is not that the United States is not ready for a robust PO plan right now, that we must keep trying to fight for one in the coming years and educating the public about the PO is. That is the wrong lesson because it is a trap. It is a trap that results in 2,000-page compromises full of loopholes. It is a trap because it involves endless negotiations about the precise variation of the public option idea that will be enacted. It is a trap because it opens legislation up to band aid periods in which we fail to end deaths, bankruptcies, and foreclosures due to lack of insurance coverage, and to endless negotiations about which parts of the population can enter the exchange and have access to the public option and which cannot. It is a trap for countless other reasons as well. The right lesson for progressives to learn now is that the present bill must be killed because it is a
Mhm.
terrible bill which makes the future worse, as I've argued, and I cite four other blogs. And once it is killed, okay, progressives also need to forget about advocating for the public option. The public option is not a goal. It is not something that can stand alone as an idea that will excite people. It is a second best tactical solution that we can accept only as an outcome that emerges at the end point of the legislative process, and only if Medicare for all, after all of our most intense efforts, can't get through that process. We cannot seek the PO in the context of an incremental legislative process and expect to be successful. We must seek and work for and move heaven and earth for only Medicare for all, whether we believe we can pass it or not. And then, if we do fail to pass it, we must be prepared to use the desire of others for any reform bill to compromise just once on a Jacob Hacker type of public option without entering a multi stage, degenerative, reflexive process that will kill the public option as an instrument for getting to Medicare um, 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 for all. Now, since these four blogs were written, there were other compromises that were suggested. One compromise, which could be characterized as a public option, was letting people buy into Medicare, okay, and to Medicaid, making that, okay, the public option. Uh, that actually could have been a lot more successful than the Jacob Hacker type, okay, PO. It would have gotten people started towards a Medicare for all bill, would have gotten many, many people out of the private sector into the public sector. And in 2009 or 2010, the Medicare program was much more effective, okay, than it is now because the Medicare Advantage program hadn't really gotten going yet. Not many people had signed up, okay, for Medicare Advantage, and the privatization of it that exists now wasn't present back in 2009 or 2010, even though Medicare Advantage still existed back then. So that would have been one possible public option to pursue. Another public option, which was not back on the table then because it wasn't, consistent with the market solution of Jacob Hacker, that kind of thing, was state-based single payer. Not many people were talking about state-based single payer back then, but one can characterize state-based single payer as a kind, okay, of public option. one that you can be very specific about and very clear about and develop model bills for and support. Now, I still think that the way you move at the national level is to go intensely for Medicare for all, move heaven and earth to pass Medicare for all. And then, if you absolutely cannot do it, refuse to do anything else. Tie up the Congress. Okay? Only agree to pass something that gets us much closer to Medicare for all, such as, for example, facilitating the passage of state level single payer bills, which allow the states to act as the providers under a Medicare Advantage program. That would work because if you pass such bills at the state level, that drives the private sector organizations uh, out of the health insurance business in states that have these particular single payer programs. And within 5 years, you could expect, an evolution to a single payer program, across the country that would be passed, at the federal level. There are a number of reasons for this from a political point of view. One important reason is that there are at least 3 clusters of states, across the country, in the Northeast, in the North Central area of the country, and in the Western area of the country, where states are ready to come together having single payer programs, and where roughly 83 million people from the West Coast, 73 million people from the East Coast, and something like another 40 to 50 million people from the North Central states would all get into single payer programs. They would be a magnet. People from red states whose governors would want to torpedo it, in their states, would eventually be overwhelmed by pressure within their states. And even if they were not, the senators from those states would be overwhelmed by demands for national Medicare for all. And everybody would be pointing to the successes in the various states. I think that is likely to happen in 3 to 5 years if there were that kind of compromise. But I'm not advocating for that kind of compromise. I am advocating for is national improved Medicare for all. And I am saying that we should do everything we can, including street level national movements, all kinds of pressure on Congress to pass that. But I'm not finished with this long stream yet, because I have to say the following. The political system we have now is much farther along to an oligarchy than the political system that we had in 2009. The media is much further along towards being a state media, even though theoretically it's private. It totally supports the 2 wings, of the uniparty, the fake 2-party system that we have here right now. It's always setting the narrative in such a way that it's all consistent with the financial corruption that we see in the larger society, and in the Congress. It's all consistent with the donor money that suffuses the Congress and that's preventing the passage okay, of any good bill. So what I'm saying is, before we move to pass the Medicare for All bill, we the people have a job to do. And that job is to follow the rule, the dump the corruption rule, which I'm going to put up there again because I might as well, so everybody is reminded of it. The dump the corruption rule is, once again, vote against every candidate except those who won't take money from wealthy corps, individuals, PACs, or party committees, and who repudiate all super PAC support. Why is that so essential? Because the likely Congress that we have right now, okay, assuming that the dump the corruption movement, okay, is not successful, that things go on as they are, and money continues to rule um, in politics. Even if we have a successful campaign by Marianne Williamson, okay, or RFKJ, or Cornel West, nothing will change. Nothing will change unless our legislatures change. Our legislatures need to change at the state level, and they need to change at the congressional level. The toxic money has to be expelled, okay, from Congress. That environment has to be changed, because assuming we get a progressive president, that president will not be able to pass a Medicare for All bill if Hakeem Jeffries is the Speaker of the House. I'm assuming the Democrats take back the House now. Even then, a single payer bill won't pass the House if Hakeem Jeffries, totally bought by the insurance industry and by the pharmaceutical industry, by the healthcare industrial complex, if he is the Speaker of the House. If Wall Street Chuck is still the majority leader, okay, of the Senate, once again, no bill of the kind we're talking about here is going to pass, in spite of the strength of a movement to pass such a bill. The stage has to be set by breaking the donor control over Congress. And you do that by defeating the people who are taking the money. That then must come first. We must have that movement for 2024. If we get it, and if we get one of the progressives, okay, who are running, then we'll be able to get a Medicare for All bill through Congress. I do think it's likely that even though an RFK Jr. is now saying that he thinks we should look to a public option, if he gets handed a Medicare for All bill from Congress, from that new Congress that we postulate as a possibility for 2024, given that he has said that Medicare for All is the best system and that he is theoretically for it, he will not veto that bill. He will sign it. And by the way, the congressional environment will be completely different the vote for a Medicare for All bill will be an overwhelming vote. And if he decided that for some reason he thought that it would be better to pass a public option, and he vetoed the Medicare for All bill, he would stand a good chance of his veto getting overridden by such a new Congress. That is what could very well happen. So, to summarize what I've said here tonight, the first thing that must be done is to dispel the choice that is being presented to us by the oligarchy, the Trump and Biden choice. And the way we do that is voting against the big money, not just in the general election, not just at the federal level, but at the state and local levels and at the levels of the primaries. In the primaries, the people who take the big money have to be defeated. We have to vote against them. We have to get them out at the primary level as much as we possibly can. We can get Joe Biden out, at the primary level if we vote against the big money, because he's going to take all the big money he can get, and it's going to come out for him. And he's completely and thoroughly corrupt. And so is Donald Trump. They're both completely and thoroughly corrupt. We need to note that this rule gets rid of them both, impacts substantially and vitally the future of both the Democratic and the Republican parties, and tells the people who run those parties they cannot be taking big money and their candidates cannot be taking big money. That's going to change the environment in Congress starting in January of 2025. We can do that. That's what we have to aim for. And once we've done that, then the Medicare for All bill that the heavy majority of us want will finally pass. And the President of the United States will sign it, because he won't be Donald Trump and he won't be Joe Biden. He will be another candidate who has not taken any of the big money. And he will sign it. And even if that candidate is RFK Jr., he will sign it too. And I have to say, I don't know if that candidate is going to be RFK Jr., because as attractive as he is in many, many ways, he has problems, of advocacy. He has key problems, on certain issues. And I think he's going to be taking the big money. So I think if we prioritize the rule, he will fall too. He will be defeated also, because we can't allow them to take the big money. That is number one. Okay, Dee, I don't know if anybody's still here except for you and me.
When you read that, it just seemed like we're back then again. It's the same issues. It's just nothing has changed.
It's the
Maybe
same
some of the people
issues.
have.
It's the same issues. Nothing has changed, except the oligarchy has gotten worse.
Yes, they have.
and their
Worse.
control over us, okay, has gotten worse through their control over our elected representatives, because they're
Mm-hmm.
no longer our representatives. They are the oligarchy's representatives. The only way to break that control is through following the rule. We've just got to do it. We've just got to build this movement.
Yes, we do, because it's just the corporations have the power, and they're always going to be saying incrementalism and all the other words we hear, and nothing's going to change.
I'm sorry, honey.
I remember when I worked at that one shop and nurses would come in and they wanted Medicare for all.
Oh, yes. Bonnie worked for a while. I guess this must have been back in 2012, 2013. Uh, she worked in a store that sold baby furniture.
Yeah.
Right? And a lot of nurses and doctors, okay, would come into that store. And they were invariably for Medicare for all.
Mm-hmm.
They were strong supporters of Medicare for all, even back then,
Because they know.
because they know. Yes.
And that's what a lot of the nurses talk about, is that a lot of their job is paperwork. The insurance company paperwork. And it's kind of like the whole thing of caring for people is slowed down because of all this paperwork that has to get done, and then deciding who's going to get care and who's not going to get care, what kind of care they're going to get. It all depends on who their insurance company is.
Yes. Okay, so, okay, I hope I was right. I thought it would be valuable to go through those blogs again and to
Oh, I thought
expose
it's a good idea because it kind of brings to mind how long we've been talking. You've been talking about this and how long, you know, people have been waiting for healthcare, and plus the whole incrementalism. It's never the right time. It's never the right time, and we have to do this first or that first.
Yeah, right. And the process, the degenerative spiral that comes out of the incrementalist type, okay, of process. See what happens to people when they get involved in that process. Their goal becomes, let's pass any bill that makes any incremental progress at all. Let's get something. We're working so hard to get something. Okay. So what the progressives did in 2009 is they kept on at each stage saying, well, we have to get something. And so they kept on taking these bad alternatives until they finally ended up with the Affordable Care Act, which was a giveaway to the pharmaceutical companies and the insurance industry, and allowed the insurance industry to stay in business and make these huge profits. That's what the Affordable Care Act did. And in the end, all the progressives voted for it in the House and in the Senate because they just wanted to pass something. They got caught up in the process, and they thought
Mm-hmm.
that refusing to pass a bad bill would be seen as a failure. And so they viewed success as getting any bill passed. So they passed, in the end, what was Nancy Pelosi's horror. The horror she created at the last minute. I didn't go through 2010 yet.
Mm.
But by the end of 2009, all the efforts to pass a bill had failed. And the Democrats would not just accept that and go on with something else, which would have been better, because they could have come back later in 2010, or they could have come back later on with the Medicare for All bill. But
Mm-hmm.
instead, they passed this horror. They claimed victory on it. They tried to run on it. They got killed in the elections of 2010. And then in 2011, when the Republicans took over, they got killed when the Republicans started playing with debt ceiling crises. And that created this whole movement was, let's have a debt ceiling crisis to get something more out of the Democrats, to make people lose further ground and give the Republicans something that they could gain on. And that led to Donald Trump. I mean, Democratic failures during those 8 years surely led to Donald Trump in 2000, okay, in 17, because they had to have a bill, just any bill that they could propagandize. So they passed Nancy Pelosi's heart.
And paying the price ever since, because
Paid the
it's
price.
always been held against. It's always been held against them by Democrats, but most of the Americans, and it was the whole thing with Romney Care too. Was Massachusetts was angry at that whole
Well,
Romney Care.
what they passed at the national level, Nancy Pelosi's horror, was a variant of Romney Care.
Right. And the Massachusetts people were furious with that. And, and so she just goes ahead with that. And then I know people too were furious about it because the mandatory of having health care and people couldn't afford it and then being taxed because you don't have health care.
Yeah, well, I just don't want to get into that kind of process again.
No.
If by some miracle we get, somebody like an RFKJ, okay, elected, and that person starts spouting the public option again, I don't want to get into that kind of terrible process again. That wasted so much time and so much effort and led to the Republicans coming back in 2010. If Democrats had passed a Medicare for All bill with a 1 year waiting period so that it took effect at the start of 2010, they would have had a landslide, okay, in the election of
Mm-hmm.
2010. They blew the opportunity to get the Republicans out of office for a generation. If they had passed the Medicare for All bill in February of 2009, they would have been free to move on to climate bills. They would have had the support to pass a much better banking reform, a much better credit card reform. I mean, for God's sakes, they could have passed the job guarantee then. I mean, it was just political malpractice. They had such a tremendous opportunity with big majorities in both the Senate, and the House. They could have gotten rid of the filibuster. They could have totally avoided these appointments to the Supreme Court. They could have codified a Roe v. Wade bill. From the standpoint of falling short of what he could have done, The worst president we ever had was Obama.
And the sad thing is, he had charisma. He could have gotten things done, but he made the choice not to.
He made the choice to get rich instead.
Mm-hmm.
He made the choice to take Bill Clinton as his model. And he thought if he saved the financial people, the oligarchy, okay, in that area, and he saved the health insurance oligarchy, he thought that when he was finished with the presidency, he could get rich. And he was right.
All right, so he was leaving money to his children.
He was in it. He wanted to get very, very rich. He wanted to become a part of the oligarchy himself. He wanted the big house on Martha's Vineyard that he had now. He has now, okay, and his other properties. He was the biggest, okay, of sellouts.
And it's a shame. It really is. And everybody had such hope, and
I know.
you really wanted to. You really wanted to take what he said as that he was going to do things. He was going to make changes.
And by the end of 2009, I was absolutely foaming at the mouth about him. Just fit to be tied. We had donated to him in the run up to the election of 2008. We had such high hopes. Such high hopes.
I know that was me too. I had such high hopes, and it just really hurt. It really hurt.
Within 2 months, we knew he wasn't going to be that. But we still did not understand how terrible he was going to be. He tried to make a compromise with the Republicans to cut into Social Security.
Well, he had Rahm Emanuel by himself, who Mr. Rahm Emanuel's plan was to make the whole country a blue dog country.
Yes, I know. And I think that was Obama's plan too. And to have austerity. He was big buds with the Peterson Foundation.
Oh, that made me sick.
Yeah, me too.
With all those meetings. Ugh.
Yeah, I was blogging about that all the time. Okay. In fact, I wrote a couple of books about the Peterson Foundation. Wrote a couple of books nobody reads. Anyway, I guess that's enough for tonight. I think we had fun.
Yes, we did, and it's like going down memory lane, right?
Yes, except it turns out that memory lane is, as you said, it's like today.
It is. It just, nothing will fundamentally change, and it hasn't fundamentally changed.
No.
And it's sad. It really is sad. And it's very upsetting because you see people getting involved in the political process, people having high hopes, the energy, people getting involved, and then nothing changes.
Okay, we're still supposed to have two people here. Okay, I'm sure one of them is you.
Mm-hmm.
But I don't know who the other is.
I shared you all over the place.
Oh, you
it
did?
Could be, yes, it could be the Facebook. The Facebook Live.
Yeah, it could be someone on Facebook that hasn't made a comment.
Right, because sometimes I remember to share. That's the thing for me is, when we get involved in the conversations, and then sometimes I'll be like, oh my God, I really didn't, do anything, because you really got to
for me to
share it out.
Okay, so folks, we are ending now. Please buy us a coffee. You have my buy me a coffee is going across the bottom of the page on the banner, and Dee's buy me a coffee is going here. Please share, like, and subscribe. Invite your friends. We need more people seeing these wonderful streams.
Right, and it just the memory refresher is important because as these politicians, these people talk about things and talk, and if you've got no, some people just weren't involved in the political process, back when. So it is good to have that refresher or have that knowledge be presented to what was going on and the energy that was going on at that particular time in history. It's important.
Yes, it is important. I think when I look at most of the people who were involved, Kay, in the Red Beret movement, in 2009 and 2010, they weren't there. In other words, the Red Beret movement was spawned by Bernie Sanders.
Mm-hmm.
They were brought into politics by Bernie Sanders.
Yeah.
They weren't paying attention to what went on in 2009 and 2010.
Yeah,
So they don't know how we lost that game in
mm-hmm.
2009 and 2010. So they might be ready to commit the same mistakes if we get another shot in 2025. But of course, we won't even get another shot unless we do dump the corruption.
We have a brainwashed population. Our state media, even though it's not called state media, but when it comes straight from Washington, a script to the media outlets, that's pretty much state media.
Yeah, it is. Okay. In fact, I think that our media is more state media than the government channels run by the Russians.
True. You hear a lot more stuff going on, the variety of stuff.
Yeah, because those seem to be acting like they're independent channels. Okay, I'm not saying they run around heavily criticizing Putin in all manner of ways. They certainly don't do that. But it seems like the RT columnists, when it comes to the rest of the world, are pretty careful to tell the truth as they see it.
Mm-hmm.
And we can't say that about our mass media here.
No.
They're not telling the truth about what's going on in the rest of the world.
They're
So,
saying what the state's telling them to say and going along with the government narrative.
yes. Okay, thanks for staying so long.
Oh, thank you, and have a good weekend.
Yeah, you have a good weekend too. You having any streams this weekend?
I'm gonna try to wait till Monday. Unless something like comes up and I really feel that I have to speak, but for the most part, I would like to wait till Monday.
Something came up. Did you see the statements that were made by Robert Kennedy, okay, in that event that was run by Rabbi Shmuley?
I haven't seen that today. It was today?
Yep.
Okay, I'll have to see it. I'll have to take a
No,
look.
it wasn't actually today. I think, okay, it was yesterday
Okay.
because I saw comments on it last night on Sabby Sab's show.
Okay.
But okay, I didn't see Robert Kennedy's statement on Sabby Sab's show because what they were focused on there were the questions
Mhm.
that were asked by some of our lefty people,
Okay.
okay, and how Robert Kennedy sat quietly in response to those questions,
Hmm.
and Rabbi Shmuley answered the people. Uh, it was totally obnoxious the way that happened. But also, Robert F. Kennedy made uh, there's about an 18-minute clip that states his position, okay, on Israel. Okay,
Okay.
so I've seen that clip. I have to check on some facts, but it's a clip that Madeline should see and you should see, okay, and that there are factual errors in that clip. I don't know how significant, okay, there
Well,
are.
we could talk about that next week. Talk about go over everything once you have a chance to review it, and then we could go over the clip.
I think we should because one thing when he was talking about the 1967 war, he talked about the Israelis responding to an attack.
Okay.
My recollection is that in the 1967 war, the Israelis saw that the Egyptians were preparing for an attack, and the Israelis beat them to the punch.
Stop it! Stop barking. Okay.
Okay, so strictly speaking, the Israelis started the 1967 war. In the 1973 war, the Israelis were surprised actually by the Arabs. That war was the Yom Kippur War. Okay. And so the Israelis suffered defeats at first in that war. And then they came back, okay, and they eventually won because, of course, the superiority of arms and, all this stuff. But for a while in the 1973 war, the issue was in doubt. In the 1967 war, that was the Six-Day War.
Hmm.
It was just a total rout by the Israelis because they attacked but first. Anyway, Robert F. Kennedy got that wrong. I think he mixed up the 67 war with the 73 war. He also made a statement that the Israelis offered to give back the territories that they had taken from the Arabs if the Arabs would recognize Israel and enter into security framework with them. And he noted that the Arabs, generally speaking, turned them down, okay, on that. But somehow he got the impression that uh, there was a deal made between the Egyptians, okay, and the Israelis, and that the Egyptians got back some territory from the Israelis after that deal. And that was true. They got back a lot of territory in the Sinai Peninsula as a result of that deal. But Kennedy also made a mistake because he said that he thought that deal also involved giving the Golan Heights back to Egypt. That's a total mistake because the Golan Heights have never given back. They are Israeli today. So there were at least two factual errors in that statement. And I haven't had a chance to check it out in any detail, but I'll bet it was shot through with factual errors.
Hmm.
I
Hey, you
think,
have to be careful.
yeah, I think the factual errors are very important. Okay, for example, he makes some statements about how the Palestinians who are Israeli citizens are treated. And I think what he's saying there uh, isn't factual. I think it's falsehoods. Okay, I'm not saying everything is not factual, but there's some of it, okay, which is not so. He made the claim that there were 3 Arabs who sit on the Israeli Supreme Court. Okay, I don't know whether that's a mistake, okay, or not, but I'm very skeptical of that statement
Mhm.
that there are 3 Arabs on the Israeli Supreme Court. Okay, he kept trying to do comparisons, okay, between the way the Arabs acted in their countries and the way the Palestinian Authority acts. He called it the Palestinian government, of course. There is no real Palestinian government because the Palestinian Authority is not really a Palestinian government in any sovereign sense. But he made comparisons about how the Arabs treat people internally to their states and how the Israelis are treating their people, okay, internally. And while some of the things he was saying may have been true sometime in the past, I mean, right now, at present, we are seeing the total disappearance of that Israel.
Mhm.
I mean, I mean, right now, today, the Palestinians in the occupied territories, they have no rights at all. We're seeing that every day. And in Israel itself, we know their rights have been rolled back significantly, and he's not recognizing that.
No, he does. Yeah, because as we know, the media doesn't tell people much. You have to really go in there and do your own research to see for yourself. And if you want to talk about people, look at the situation before Israel came in, and you had people leading their lives, having their businesses, and doing things, and it was
Oh, that
different.
was something else that was, I think, okay, was incorrect. Robert Kennedy made a statement about at the formation of the Israeli state, he claimed that there were only about 500,000 Arabs, okay, in Palestine, and there were something like 650,000 of the Israelis by that time. Well, there was 650,000 Jews at that time in it, but I believe there were many more Palestinians. Okay, in other words, there was no Jewish majority in Palestine at that particular time. Now, when the United Nations partitioned Palestine into 2 parts, okay, and gave the Jews a particular area to settle in, and the Arabs a particular area to settle in. Uh, at that point, in the area the Jews were supposed to be settling in, there may have been a majority of Jews following the Nakba, just at that moment, but before the declaration of Israeli independence. There may have been a majority of Jews then. I don't know, but only in the area of Palestine, which the UN had ruled, was going to be the area in which a Jewish state might be formed. But Kennedy seemed to be making the claim that in the whole of Palestine, uh,
Mm.
there was a majority of Jews at that time. And I know that wasn't true.
Exactly. We know that.
But all these
Oh.
errors of facts could easily have been remedied just by going to Wikipedia.
But he's listening to these particular Zionists that are telling him things.
Yes, I know. He's listening to Rabbi Shmuley, and Rabbi Shmuley. I mean, I'm going to look into the background of Rabbi Shmuley. Sabby did a little bit of that, okay, in her show. Okay. Rabbi Shmuley is evidently or was a Trump supporter.
Hmm.
I think now he's probably going to be a Kennedy supporter because some of the statements he was making, at that event he held, it was so. I mean, the statements he was making, concerning RFK's statements and pronouncements was so over the top. That you've got to figure he's going to turn into an RFK supporter as opposed to a Trump supporter. But he evidently had some association with Trump, okay, in the past, and he evidently was a Republican in the past. In fact, he evidently ran for Congress as a Republican candidate.
That's not good at all because we saw how that was when Trump was in office.
We certainly did.
Ugh.
And we know it's totally corrupt.
Yeah.
Huh. We're still live, and it's 2:36. Okay, I didn't end this. I'm going to end the broadcast
Okay.
at this point.